Good day everyone, I am Stephanie Lee, a second-year nursing student from JH Cirulia State College, Pagadian. For today, I will demonstrate the proper postpartum head-to-toe assessment using the BUBBLEHE technique. BUBBLEHE stands for breast, uterus, bladder, bowel, lochia, episiotomy, home and sign, and the emotional status of the mother. Before the assessment, we have to prepare the necessary equipment. To check the mother's vital signs, we need a blood pressure cuff, stethoscope, and thermometer. For the head-to-toe assessment, we would need clean gloves since we will be handling body fluids such as breast milk and blood. And of course, again, the stethoscope for auscultating the bowel sounds. I have washed my hands before coming to my patient, and then I already gathered my equipment. I have observed appropriate infection control, and then the room is well lighted for this assessment, and the client's privacy is already well attended to. Hello ma'am, I am Stephanie Lee. I am a student nurse from JH Cirulia State College, Pagadian, and I will be attending you for today po. Before we get started po, I need to verify your identity, ma'am. Can you please state for me your full name and date of birth, please? Okay po. Ma'am, how are you feeling today po? Is there anything bothering you po? No, okay. The reason why I'm here, ma'am, is because I will perform a head-to-toe assessment on you po. Your body is expected to change radically in the 6 weeks post-labor, and a postpartum assessment help us an idea or give us an idea of how far along you are in your healing process. However, ma'am, this assessment is not just about your physical condition. I will also evaluate your psychological status. I will examine how you are doing emotionally and what your needs may be going forward po. Is that okay with you, ma'am? Okay po. Everything done here, ma'am, will be confidential, so you don't have to worry about it. Only me and the rest of the healthcare team who are attending your proper care will be the one to know your assessment. Okay po. I will just put on my gloves po so that we can start the assessment po. Okay po. To start po, I will be taking your vital signs, ma'am. So, just relax your body po. Your vital signs, ma'am, your blood pressure is 110/80 po. That's normal po, ma'am. Next po, your temperature. Okay po, your pulse rate po is 70 beats per minute po. Your temperature is 37 degrees Celsius. Okay, we will proceed to the head-to-toe assessment po. In this phase, ma'am, I will need to touch and examine your private parts po. Can I get your consent for that, ma'am? Okay po. Let's start with your breasts po. I'm going to expose them, okay? Raise your hands, ma'am, and then tap them under your head. This stretches and thins breast tissue. Ma'am, are you feeling any soreness or painfulness in your breasts po? How did they feel po? Is it heavy, full, or just normal po? Just normal, okay po. I'm I'm going to palpate your breast po, okay? Her breasts are soft, non-tender, and warm to the touch. Her nipples are round, which is a good sign of breastfeeding latch. Now, ma'am, we're going to move on to your uterus. I will just need you to lie flatly po, okay? Gently po. Are you comfortable po? Just gonna expose your uterus po, okay? We need 2 hands for a fundal check. My right hand will be supporting the bottom of the uterus and the other is to feel for the fundus. The fundus is midline, which is in the middle of her stomach, and it should be at the level of her belly button. Okay, her fundus is firm. Now moving on, next is the bladder assessment. Ma'am, when was the last time you got up to go to the bathroom? Oh, okay ma'am. It is crucial po that every 2 to 3 hours, you want to try to go to the bathroom even if you don't feel like it. We advise you to do that ma'am. It's because having a full bladder can be dangerous. By avoiding frequently, you're going to bleed less, you're going to heal faster, and it's going to be a lot less painful po. Okay, ma'am? Now, next is the bowel assessment. Now, ma'am, I'm going to listen to your bowel sounds. The bowel sounds are active and regular. Ma'am, when was the last time you had anything to eat or drink? Oh, okay ma'am. You're allowed to eat po. It is best to eat or drink something because your body needs the energy it can get for you to take care of your baby po, especially if you're breastfeeding. Okay po ma'am. Now we're gonna move on to your lochia ma'am. So, I'm going to need to examine your vaginal discharge. Is that okay with you ma'am? Okay po. Let me fix your pillow first po, okay? Gonna check it now, okay ma'am? Ma'am, when was the last time you changed your pad po? Yesterday pa po? Okay, ma'am. It is essential essential po to change your pad frequently. So even if you don't feel like you had to pee, get up and go every 2 to 3 hours. While you're in there, mom, change your pad. Even if there's not a lot of blood in your pad, you should still change your pad every 2 to 3 hours, just like going to the bathroom po. Before going to the bathroom, mom, make sure that you fill the peri bottle or the sitz bath with warm water. And then, rinse the stitches area after each voiding or bowel movement. After that, mom, wipe from front to back, patting it gently po. You can then change your peri pad after each voiding. Don't forget to wash your hands after, ma'am, okay? Let me check that again, ma'am. The patient's vaginal discharge is lochia rubra. As we can see, this is a kind of bright red blood. We expect this kind of discharge on a newly delivered patient for the first 3 days after delivery. So, on days 1 through 3, we have lochia rubra. Mom, when you went to the bathroom, mom, did you notice any blood clots? Do you remember how big it is, mom? Is it a coin size or the size of an egg? Oh, you can't remember po. Then, call me, ma'am, if ever you notice any blood clots whenever you go to the bathroom, okay? Okay po. After the assessment po, we can change your pad. For the following assessment, I will be checking the patient's episiotomy. The patient didn't undergo an episiotomy in this case, so I will be just assessing for any 2nd to 3rd degree tears and any bleeding, redness, bruising, and discharge. There's no abnormal redness and bleeding. Next, I will be checking the Homan sign of the patient. With Homan sign, we are checking for DVTs. We're going to first expose the leg. Ma'am, just relax your legs, okay? Support kind of under the knee, and then the other hand is to sharply dorsiflex the foot. Ma'am, do you feel any pain in your calf po? No? Okay. And then next, check for any redness, swelling, or warmth in your calf. No calf tenderness, edema, and warmth. And then next, you also want to check their pedal pulses. The pedal pulses should be normally a +2. And then, the next leg. Ma'am, do you feel any pain in your calf po? No, okay. No abnormalities found. Lastly, the emotional status of the mother. Regarding her emotional status, I can just observe the 3 stages, which is taking in, taking hold, and letting go. Since my patient just gave birth, I can assess that the patient experiences a taking in phase in the first 24 to 48 hours, focusing on herself and her recovery. Afterwards, she will experience the taking hold phase, where she shifts her focus to her infant. She has a strong support system. Her husband is here. Overall, her emotional status is good. That's all for the BUBBLEHE technique. Ma'am, thank you so much for your cooperation. Just call me po if you need any help or assistance, especially if your husband is not here, okay? Okay po. Thank you so much for watching. This is Stephanie Lee, your student from BSN 2A.